South Africa is amongst a group of 12 countries on the continent planning to eradicate AIDS-related deaths of children by 2030. This will be done through HIV testing, treatment and prevention programs. African Health Research Institute Professor Thumbi Ndung'u joins us to talk more about this. A very good evening to you, Prof. Good to have your time. Where are we seeing the highest levels of AIDS-related deaths among children in this group of countries?
Well, thank you very much for having me on the show. I think it's fair to say that AIDS-related deaths are highest in those countries that have not managed to control HIV infection generally, and that means countries with low uptake of antiretroviral therapies in general. So if you look at HIV/AIDS pandemic, it's primarily affecting the most countries in East and Southern Africa, and particularly those countries that have low antiretroviral therapy coverage. That includes countries like Kenya, Mozambique, South Africa itself, and Zambia. So these countries that have not had as high uptake of antiretroviral therapy are the ones that are mostly affected, whereas countries that have done very well in terms of antiretroviral therapy uptake, such as Botswana, are doing relatively well when it comes to child-related deaths as a result of HIV/AIDS.
South Africa had a slow start as far as the antiretroviral treatment dispensation is concerned. It even had to go all the way to court, but once it got rolling, I think at some point we had the largest antiretroviral rollout program. Where do we stand as far as access that's able to prevent the deaths of children from AIDS-related illness?
I think generally speaking, actually, South Africa has done very well in terms of reducing the number of HIV-related deaths in children. But there are pockets of where antiretroviral therapy really has not been able to penetrate. So if you look at new HIV infections among children, it is still very high among marginalized groups that don't have access to HIV services. So people who are marginalized and don't have access to health care, who don't have access to testing, and who report late for antenatal care, individuals who are outside of the healthcare system. These are the pockets where you find that there is a lot of high HIV transmission among children and AIDS-related deaths. And of course, we should also not forget that there are adolescents, children who are born with HIV, that also have challenges in taking antiretroviral therapy and having access to antiretroviral therapy, particularly when they reach puberty. And this is where now it becomes very problematic, and we need really focused programs that can focus on these groups of marginalized people as well as adolescents in order to stem AIDS-related deaths, which are preventable, obviously.
What are the official illnesses that are actually killing these children? We talk about AIDS-related illness, but what are the most common causes of death?
The most common causes of death would be TB. TB is the highest killer among people living with HIV, including children. So this is primarily what we are seeing. But I think among children also, because of the inability of children to adhere to antiretroviral medication, you actually do find that there are children still who are dying of AIDS itself because of the fact that they are not able to be adherent to antiretroviral therapy, or their caregivers are not able to administer antiretroviral therapies. And so you find that there are many children who are dying of AIDS itself, which we shouldn't have because of the fact that we have very, very effective antiretroviral therapy. And we also have very high levels of transmission, particularly, as I said, among people who are outside of the healthcare system and who have not been able to access testing and who have not been able to access antiretroviral therapy.
But it is shocking, is it not, Professor Ndung'u, that decades after the first antiretroviral drugs were rolled out, we still have people in communities in Africa who don't have access to those drugs. Is it an issue of cost? Why is it still so bad that people are dying of AIDS-related illness?
I think it's primarily a question of access to healthcare services. I think that in countries that are particularly low income countries, you have pockets of people who are completely outside the healthcare system and who are marginalized, and for whom the services for HIV testing, for example, and even treatment, these services have not reached these populations. So it's a big shame, actually, as you say, that there are populations for whom these services have not reached. So we need to do much more in order to obviously prevent this, otherwise highly preventable deaths. And the only way to do that is to ensure that the healthcare system, the public healthcare system, because these are people obviously for whom private healthcare is not possible. So we need universal coverage of these marginalized groups of people so that they can get access to testing, particularly early testing for women who are pregnant so that there is no transmission of HIV, but also early treatment so that this can prevent transmission but also prevent HIV and AIDS-related deaths.
Professor Thumbi Ndung'u, good to speak to you, sir. Thank you for your time tonight.